Good evening, and thank you for joining tonight's live town hall meeting hosted by Douglas County in partnership with the Douglas County Sheriff's Office, the 18th Judicial District, Loantree Police, and Parker Police. We'd like to welcome all of you that showed up in person and the dozens of you joining already online and on the phone. Tonight's live town hall is focused on a very serious topic you've probably heard a lot about, fentanyl. You've seen it all over the news. It's the illicit drug that is becoming more and more prevalent. It's here in Douglas County, and we do need to talk about it. I'll turn it over to Commissioner Thomas.
Thank you, Commissioner Layton. Thank you all for joining us tonight for this very important community conversation. We have all seen the news coverage recently. We know that while fentanyl has legitimate uses, its illegal use is causing a growing problem. While many of you may have a friend who's lost a loved one to fentanyl, I have dear friends whose daughter's heroin was laced with fentanyl and they lost their daughter. And so this is personal to many of us. Tonight, Douglas County Sheriff Tony Spurlock, District Attorney John Kellner of the 18th Judicial District, Parker Police Chief Jim Tsurapas, Loantree Police Chief Kirk Wilson will give us local context for this growing national crisis. We want to get your questions tonight, so please stay on the line. Commissioner Teal.
Thank you, Commissioner Thomas, and thank you all for attending. We have a nice full room. Panelists, thank you very much for attending and helping us out with this. In preparing for this live town hall, I was surprised to hear that one of the most effective age groups in Douglas County are students and young adults, literally ages 16 to 30. And I know I read that, but when I heard that, I really was surprised. It didn't strike me, it struck me that this shouldn't necessarily be the group that is most affected by this, particularly here in our own county. We will also hear from our public safety partners about what we, as parents, can do to keep our kids safe. And we'll take your suggestions. Here is our moderator to tell us more about the format of tonight's call. Roger?
Thank you, Commissioners. Again, we want to get your questions tonight. So to ask a question on the phone, press *3 on your telephone keypad, and you will be transferred to an operator who will take down some information. Once the operator notes your information, you'll be returned to the call and can listen to our conversation until it's your turn. Since we'd like to hear from as many people as possible, we'll ask you to limit yourself to one question, and when it's your turn, I'll call your name and ask you to repeat it for our live audience. You can also participate online by visiting douglas.co.us/town hall. So *3 on your phone, and let's get you in the queue. We're going to jump right in with a question first from Commissioner Layton.
Thank you, Roger. Let's start with a question that was submitted online. This came in from Sarah. Sarah asks, our community is seeing fentanyl all over the news. It's easy to think that it's not here in Douglas County because we're a safe community. Can you tell us what the situation is here locally? How prevalent is this drug? And I'll turn it to Sheriff Tony Spurlock.
Thank you. This is Sheriff Spurlock. I think it's so important that we put our mind's eye to the fact of what's happening, not on the news, not on Hollywood, but what we see here in Colorado, and let's pare this down with Douglas County. And now for just a little bit of anecdotal information, 10 overdoses already confirmed from fentanyl, saved by a variety of different ways, 5 deaths that are connected to fentanyl-laced drugs. The important thing for us to remember that this is not one of those kind of drugs, or in our mind's eye, that it's the guy hiding over in the corner, or it's in the alleyway, and he's got a needle in his arm, and he's all dirty, and he's got sores on his face or whatever. This is a drug that is used by middle-class America for entertainment purposes. And that is why it's so incredibly dangerous, because they are lacing, drug dealers, manufacturers are lacing cocaine, heroin, marijuana with fentanyl dust. And and it's killing our citizens. And from Douglas County side, and I know the chiefs will probably have some information as well, we are seeing it at an epidemic rate here in Douglas County by people that have jobs, pay mortgages, have 2 cars, have children in their house. So it is something important that we need to remember that it is occurring here.
Did any chiefs want to weigh in on that question?
Sure. Good evening, everyone. Jim Tsurapas, Chief of Police with the Parker Police Department. You know, to echo what the sheriff was saying, we're seeing a drastic increase in the fentanyl cases that we're dealing with. Our officers are responding to calls for service, whether it's motor vehicle theft, you know, domestics, just all types of different calls that we respond to. It's here. We're seeing it. We're, you know, confiscating a lot of the fentanyl. You're seeing a lot of overdoses. We're dealing with a lot of death investigations that are related to, you know, fentanyl overdose. You know, you're seeing a lot of other drugs that are laced with fentanyl. So a lot of people that are taking these drugs, especially a lot of the kids, they don't know what they're taking because it is laced with fentanyl. It's very, very potent, and we're seeing a lot of those effects in our community. And we looked at some stats. Year to date from last year, April 1st, 2021 to March 31st of 2022, we had 85 fentanyl-related cases that we responded to. The year prior, we had 25. So we're seeing a drastic increase in our community as well.
This is Kirk Wilson with Loantree. So I think we're seeing it in every community. I was on a call not too long ago with the mayor's caucus from the metro area and a bunch of other chiefs talking about some other issues, but fentanyl was laced through, no pun intended, but laced through the entire conversation as it relates to motor vehicle theft, how it impacts our businesses, and of course how it's impacting our just everyday citizens. But you know, when we say it's a little more powerful, it's 100% more powerful than morphine. So it is a highly addictive drug, and I think it's impacting us. I think it's impacting the transient population. And I think we talk to people that we come into contact, young folks or maybe are transient. Just a few years ago, they were productive, and now they're on fentanyl and they're living on the street. So it's a very, very powerful drug, and it's really impacting us in so many ways from a law enforcement standpoint, but more importantly from a community safety standpoint.
Thank you, Chief. Let's take a quick comment from the District Attorney, and then we have a question online. So District Attorney John Kellner, let's take a couple of steps back. Can you tell us more about the chemical makeup of fentanyl and why it's becoming so popular for the drug cartels?
Thank you, Commissioner Thomas. Good evening, everyone. My name is John Kellner. I'm the District Attorney for the 18th Judicial District, which encompasses Douglas County. It's a great question, you know, and the bottom line as to why cartels find fentanyl to be so attractive as a product is that it's cheap and easy to produce. The chemical precursors are generally manufactured in China. They're shipped to Mexico, and they're basically concocted in clandestine labs for the most part. And the reason why cartels prefer fentanyl over other types of drugs is that I mentioned it's cheaper, and if you think about it, it's not agriculturally based. So if you want to look at, you know, cocaine, which is derived from coca leaves, and you have to cultivate a whole, you know, field to produce your product, you don't have to do that. You can just have a small lab, maybe an eighth of the size of the room that we're in right now. The same thing with heroin. I recall as a young Marine officer being in Afghanistan and seeing just the fields and fields of poppy, which would ultimately require a ton of labor to, you know, produce that opium and ultimately create heroin. They don't have that issue with fentanyl. And because they can produce it into essentially, you know, a powdery substance, they can condense that down into a small brick that is easily smuggled across the border through many of the same, you know, ways that we've seen other drugs smuggled over the years. But they can take, you know, one brick of this, a kilo, which might be worth something around $30,000, and produce from that, once they mix it with filler, you know, $1 million worth of a product. So it's cheaper and easier to produce and also to introduce to our communities. And one of the other things that they're finding to be really effective is that, cartels are actually able to pill press different types of pills depending on what that market is. And so you might have somebody that wants to purchase a Xanax on the street, or somebody wants to purchase oxycodone or oxymorphone or something like that. A cartel-based operation can buy basically a pill press, $100 to $200. The marker for it, the pill press itself might be somewhere around $1,000 to $1,500. They can put the fentanyl with a filler, and you can get filler anywhere. You can just buy acetaminophen, basically aspirin or something like that, crush that down, mix it with fentanyl. There's no quality control here, though, and the problem is that just 2 milligrams of this stuff can kill. And so very often, the DEA estimates 40% of these pills that are being manufactured are making a circulation, and 40% of those have a lethal or potentially lethal dose. So it's a confluence of all the worst things that are hitting our community all at once. Back to you, Commissioner Thomas.
Thank you, District Attorney Kellner. Roger, I think we have a call.
We do. Let's hear from Steve. Steve, go ahead. You're live.
Thank you so much for all of you addressing this topic. Hits me very close to home. My daughter, the 27th of this month, will be gone from me for 1 year. She had a lot of situations that needed to have pain control and had prescription oxycodone that she took quite regularly. She died of pure fentanyl, and we're still trying to figure out how that happened. But yeah, I think you're exactly right. It looks like they're able to make that tablet, because we looked at it. It looks exactly like the oxycodone tablet, the same lettering and everything. My guess is maybe she ran a little short on her prescription and borrowed some. We don't know, but she died instantly in the middle of the night, and that's never a call you want to get about your daughter. So thank you for addressing this. I'm wondering if there's going to be a way that ones can bring any drugs that they might have to have them tested, because like you say, if it has very much fentanyl at all, it'll be the last time they take that pill. So that's my comments, and just appreciation for you addressing the topic.
Thank you, Stephen. We're very sorry for your loss. A year already. We're sorry. Before we send this over to Commissioner Teal, I would just like to remind everybody to press *3 on your keypad if you would like to ask a question. You can also participate online at douglas.co.us Town Hall. Commissioner Teal.
Thank you, Commissioner Thomas, and thank you, panelists. I wonder if we can hear, before we go with the next question, if we can hear from the panelists in response to that gentleman's story and that question that he had about, is there a way that pills can be brought in to get tested if somebody suspects they may have an illicit a drug?
I can take a quick crack at that, Commissioner. Here's the problem with it, and again, we're very sorry for your loss. If someone was to bring in, let's just say at the sheriff's office, and you were to bring some pills in and we were to test those, the danger to the person testing is astronomical, because we do not know how much fentanyl is any kind of pill. I can also tell you that in our jail division, we've had officers who have been contaminated with fentanyl drugs because they were taking them off of an inmate that was trying to smuggle them in. They touched them or they breathed it, and now they're impacted. So I I wish there was a simple litmus test that we could give people, but it's very, very problematic to be bringing in those kinds of drugs into and say, hey, is this an illegal drug? And I think the DA has a comment regarding that, but I just don't know of an option where that would be safe for all parties involved.
DA Kellner, did you want to add to that?
I did. First of all, sir, I'm very sorry for your loss. I think everybody at this table has been hearing every couple of days a story like that. I know I've spoken with 2 families this week who lost somebody that they care for, that they love, to fentanyl. And here's what I would suggest, sir, is that if it is not a lawfully prescribed prescription that you got directly from your pharmacist, it needs to be thrown away safely. I know we just had the DEA Take Back Day. That's the right time to get rid of that stuff. Do not try anything that you do not get directly from your pharmacist, because right now all kinds of drugs that are illicit on the street are laced with this stuff. And though you might be able to get a fentanyl testing strip, and I know that's part of some of the legislation that's at the Capitol right now, is to increase funding for fentanyl testing strips. That's a good thing, but don't take the risk. If it's something you don't recognize and you don't know where it came from, please dispose of it properly.
Thank you, Dee. I appreciate that. So, folks, one of the benefits of coming and actually being in the room for these is the opportunity for you to ask a question of the member of the panel. Anybody like to ask a question of the panelists right now? Yes, ma'am. Oh, here, I'll give you the microphone here, too.
Probably don't need one. Hi, my name is Raquel Garcia, and number one, I am so grateful that you guys are having this conversation. I am a Douglas County resident. I also live back end of El Paso County, right there at the Larkspur-Douglas County line. I am a woman in long-term recovery, and by the grace of God, I haven't had a drink or misused a pill prescription in over 12 years. And I am somebody, thanks. And I am somebody who had a strong addiction to Opana, which is right off of that same family. And so I have some other guests here also that also have overcome addiction. So my question is more for the recovery of than dealing with people. We do have a community center we just placed here in Douglas County to help combat that. But other than myself, what other resources does Douglas County have for the treatment and support of people who are currently dealing with that, who cannot afford regular standard treatment? We do know of Parker Valley Hope in Parker, Colorado. I'm actually a graduate of Parker Valley Hope. I got there from out of there 12 years ago. But other than that, and the other 2 treatment centers sitting on northern El Paso County, there's not much treatment once people have actually taken the drug. So why I planted myself here, I'm right next to Santiago's Burritos. I leased out the entire building. I run Hard Beauty, and we are a peer recovery coaching practice. But I would like to partner also with Douglas County, because we can actually do some intervention before they actually hopefully get to jail. So other than the treatment centers, what other community organizations does the police department and sheriff's department partner with for referrals and things to help community out?
So, ma'am, thank you so much for being here. We are thankful to have you as a Douglas County resident, bringing light and recovery to not only yourself, but your neighbors. Thank you to all of your friends that are joining us tonight. We consider them our friends as well, so thank you for being here. I'd like to ask the DA and the sheriff to answer that question as well, but I was thankful to have been appointed by the Attorney General to the State Opioid Settlement Committee. Well, it was quite a process. Thankfully, it was a combination of all of the municipalities agreeing to an MOU, allowing regions to be developed within the state to address opioids. So one of the things we fought hard to accomplish was to make Douglas County its own region. So we will have about $4.9 million to treat opioid addiction right here in Douglas County. And hey, we always say we don't wait to do great, so I would love to invite you to stick around. I'm going to give you my card, and I would love to have you be part of that committee. So we'll just get that done right now. I'll give you my card right here. I'll walk over and give it to you. But we'll start that soon. You know, the MAT treatment and the peer support. There's so many opportunities, but I would love to get your input. So thank you. Thanks.
So our producer, Roger, is desperately gesturing to me. Roger, I think we have an online question that we're going to refer to our partners with the school district.
That's correct. Katie asked, are we seeing overdoses in high schools?
Me too. Please do. Hi, I'm Andy Abner. I'm Deputy Superintendent with Douglas County School District. Thank you, Katie, for the question. So we're not necessarily seeing overdoses. Our numbers are very similar to Sheriff Spurlock's numbers. However, we do know that they're impacting the community of the high school, whether that be with parents or students or whoever it may be. They are definitely being impacted. And because of that, our SROs are carrying Narcan on person and also in their vehicles. And we recently have moved forward with a grant with the state of Colorado that's going to allow all of our schools to have Narcan within our schools as well. So we're anticipating that Narcan, as soon as it's approved and it arrives, it'll be in our schools. We suspect that we'll be able to do training with staff during the first quarter, which is between August and October.
All right. Well, thanks so much, Andy. Oh, no, if you want to applaud Andy, go ahead. Everybody, please. All right. Hey, Abe, I think we're tossing to you.
So I know we have a lot of additional questions for our DA and our sheriff. We also got a question that was posted to our Facebook page, so if they could maybe address Raquel as well as this Facebook question. Ashley asks, what are our state legislators doing to stop the influx of fentanyl across the border, which is the larger impetus to this problem? Are the Colorado law enforcement officer communities, organizations, unions, et cetera, pressuring for remediation to this? They're the ones dealing with the fallout. DA?
Thank you, Commissioner. I'm going to start with Raquel's question about resources. And obviously, as the district attorney, most of the time that I interact with folks, it's in the justice system. First of all, yeah, and we need to help them. I mean, that's most of our cases, and I feel like it's a bit of a myth. You know, nowadays, in the last, I'd say, 15 years, people don't go to prison for a drug possession case. We're really oriented towards treatment and trying to get help. And, you know, we dealt with a lot of Opana cases about 7-8 years ago. Yeah. It's the same sort of family. It's a synthetic opiate. It's just as deadly in many ways as fentanyl. Okay, so what we do in the DA's office, we have a lot of different programs. We've got a drug treatment court, where we have people that are really struggling, like high risk, high need people that have regular interactions with court staff, with treatment providers. They check in a few times a week when they first start, so it's a lot of touches with the system, and then we back off as they progress. That's been a very successful program in our problem-solving courts like that. We usually have very low recidivism rates, some are around the 10% or less, which is pretty fantastic when the average recidivism rate is around 50% for the state. And we also have a diversion program that's specifically focused on people who are struggling with addiction. So if it's a low-level possession case they come in, we try to connect them directly and not wait for a month or so before they see the court, but connect them directly with All Health Network, one of our community partners, to do an initial screening to see what kind of treatment, how much do you need. They put a plan together, and if the person goes down that path, let's say they need to do 6 treatment sessions. If they do 4 or 5, we will actually dismiss the case and hopefully continue with them, in their path towards recovery by trying to sort of minimize, in many respects, that interaction with the justice system to keep them on that good path. So we've got a lot of different ways in which we approach that. And I'm going to pass it to Sheriff Spurlock to answer that question, and then I'll try to circle back to the issue about fentanyl on the border.
So a couple things, and I would encourage you, and I'm going to say their names right quick, and I encourage you to copy their names and call them. And these are Speaker Garnett, Representative Lynch, or Senators Pedersen or Cook. They're the ones that are sponsors of the House Bill 22-1326. That's the fentanyl bill. There's a couple things with that. The County Sheriffs of Colorado, the Chiefs of Police Association have all recommended and suggested changes to that bill. There's a couple things that's a problem with the bill is that it's a specific bill about fentanyl. Okay? That is incredibly difficult for law enforcement, and it's even going to be more incredibly difficult for the DA to prosecute when it's so finely narrowed to a particular drug. The other part of it is that it limits our ability to go after the dealer, to move up the chain. And so, yes, we are playing an active role in this bill, but I can tell you that we need the people, and that's you that are in this room and that are listening on this, to call those senators and those representatives and say, listen, we want you to listen to the County Sheriffs of Colorado, the Colorado Association of Chiefs of Police, because we have a statement letter here that basically lays out how we, who are charged with protecting the citizens of Douglas County, and how we are to investigate it, and how we partner with the DA, how we can help them fix this bill. So to answer the question that was online, we are doing a great amount of work, but we need the people to help us. We need the people to speak out, and I think we can make some things happen.
So if I may dovetail on that, as we're talking about fentanyl and the border, at that point we're obviously talking about generally transnational drug organizations. The district attorney's office, in partnership with a lot of the folks here, chiefs of police and Sheriff Spurlock, we're actually part of different drug task forces where we use all the tools that we have in our tool belt, to include wiretap investigations to go after these drug trafficking organizations. In December, we seized over 110,000 fentanyl pills. We indicted 19 individuals associated with one of these alleged drug trafficking organizations. As part of that, we actually also seized, I think it was 28 firearms, many of those with large capacity magazines. Most of them were assault rifles, 4 hand grenades, body armor. And so the reason why I mention that is that you have to understand that not just the drugs that are very deadly, but the drug trade and the people that are involved in the drug trade around it are potentially very dangerous and potentially very deadly in and of themselves. So we continue to work those cases where we're trying to go after the people who are importing this stuff into our communities. One of the good things in this bill, and I share Sheriff Spurlock's concern that we do need to change some aspects of this bill, is there are increased penalties for us to be able to go after importers that bring it into the state. So there's actually good movement on that front. We're very pleased with that part of the bill. I share Sheriff Spurlock's concerns that there are some things we need to change, and I'm sure we could get deeper into that too the farther down we go here.
Thanks, DA. I think that's really helpful information. So it looks like we have a phone question. Roger?
Yes, we do. Let's hear from Diane. Diane, go ahead.
Hi, yes, my name is Diane. I live in Parker, and a shout out to the Parker Police Department for the wonderful work they do here in my community here. I have great appreciation for their hard work. And I feel very safe here in my community. And I know tonight we're talking about fentanyl, and my understanding of the drug is the relief that can give someone that is struggling. It could be a party drug that people aren't aware when they're taking that it's not a fun thing that they're doing. However, my belief, and I've been an advocate for mental illness for decades, and this and opioids and others, I mean, to me, a lot is the root cause of people who struggle with anxiety and depression. I have worked with that in my own regard for years. But once you take, when we look at, we have two people that are, very were present in the celebrity manner who succumbed to fentanyl, who both suffered from severe anxiety depression, such as Michael Jackson, and of course Heath Ledger, the actor Heath Ledger. I appreciate absolutely that the criminal aspect needs to be attacked, but I want to know how this also can be combined with working within our schools, especially for our young people, in getting them to understand if they're struggling with anxiety, if they're struggling with depression. It's not something that they need to be ashamed of, and how we are working within our schools in that regard, because I believe that we've got to go into these root issues of these mental illnesses to help also then prevent people from wanting to take these drugs. Go ahead.
Thank you for wealth. I think that's a really good question, and we're thankful that we have representatives from the school district here to perhaps answer that question. So let me walk over and hand them a mic.
Thank you. I want to hear.
Hi, I am Kelly Smith. I oversee counseling, nursing, intervention supports for Douglas County School District. And I love that question because we work very hard in Douglas County and continue to work with a lot of grant and donation funding that we've gotten to help with preventative programs within our schools, training staff. We now have, through the bond mill levy, we have a counselor in every elementary school and the ratio of 250 to 1 in our middle and high schools, and they work a lot on prevention and supporting students with mental health concerns, anxiety, all the stuff that she spoke about. It is one of the top priorities that we have in our district, and we're continuing to work very hard in making sure that our students know the safe person to ask, where to report, what they need to do when they need help, and we continue to work on building that plan out in the next years.
Thanks so much, Doctor.
So just a reminder to everyone to press *3 on the panel if you have, on your keypad, if you have any questions. Was there a doctor online that might be able to help with this question, Roger?
Dr. Long is on the line. Do you have any comments on that last question?
Yeah, actually, I'll, because I was, what specifically about that, and I apologize, what specifically was in that statement that we were asking? I know what I heard was about, let's ask about schools and what resources were available.
I think the connection to mental health.
Yes, Doctor, it seemed like the connection was to mental health and anxiety and why people were turning to these illicit drugs and ending up with this fentanyl crisis.
Got it. Yeah, so really what it likely comes down to is it's self-medication. It's an extreme form of alcohol is a drug. Alcohol is a legal drug, and you can imagine how what people will say is they've had a hard day at work and they come home and have a drink. So that's self-medication. And people with anxiety and people with depression, they can run with that. It's not always the case, obviously, but it can lead to the use of illicit drugs. It can really be used for even medications that are prescribed by a physician. The topic of tonight is about fentanyl. And I think it's pretty well accepted that a lot of people get their start, unfortunately, with prescription medications, prescription narcotics that physicians will prescribe for, somebody that has some sort of a pain ailment. And not everybody that gets a prescription for Vicodin or Percocet from their doctor ends up becoming addicted to it, but some people do. And some people that have even far more serious injuries or pain conditions. That one of the, I think somebody in the audience or one of the callers said that his daughter had some ailments, some pain ailments. And so people that are chronically on medications or on these narcotics that are prescribed for longer periods of time certainly will have a higher risk of becoming not only mentally and emotionally addicted to narcotics, but physically as well. So I think the answer to the question is people kind of self-soothing and self-medicating. And unfortunately, it is a slippery slope, and taking one medication can lead to another, and can ultimately lead to seeking out more powerful and illegal ways to soothe themselves.
Thank you, Doctor, for that information. Roger, I think we have another call online.
We do, and I was just going to note that was Dr. Long is the Chief Medical Officer at Skyridge Medical Center, so for those of you that were listening on the phone who was talking there. Let's hear from Vivian next. Vivian, go ahead.
Hi. Hello. I also want to thank you all for putting this on tonight. It's an extremely important issue. I have a couple of questions, just two. But first of all, I want to know what is the police department doing to help protect the officers when they go out and touch any kind of drug, actually, but especially fentanyl?
Hi, Vivian. Thank you for that question. For our officers, because we don't know what we're coming in contact with when we're dealing with people out on the street, if it's in a powder form, there's some devices out there. One is called Trunark, and that system is a laser system that shoots a laser inside of a plastic bag or whatever the powder form is in, and it'll analyze the compound so the officers don't have to open the actual bag and get that exposure to that unknown substance. It'll tell you what kind of compound that is, and if it does come back positive for fentanyl, you can keep it sealed, put it in another bag, and then you can send it to get tested further or to get destroyed. I know Loantree and Douglas County, I think both have the Trunark system. We've utilized that, and I think we're getting ready to purchase one as well to provide that safety to our officers. But it's very potent, and we try to educate our officers as much as possible. Same thing with our canine officers that do the drug detection when we call for a canine car. We have to be careful with the dogs as well, because they can get that exposure and also have the effects of the fentanyl overdose. So that's what we're doing. I think Kirk can elaborate on that.
Well, this is Chief Wilson with Loantree. So we also, I'm pretty sure I speak for everybody, we also carry Narcan. Every officer has probably 2 doses of Narcan on their person or in their possession at all times. And we do a lot of training on what precautions they need to take. We've had to put policies in place that when I was a patrol officer, we weren't as worried about what we were, we'd always wear gloves, but that was about it. But now, we have protocols in place. We have to wear goggles and masks and be in a certain type of, if we're going to open it, a ventilated room where you could expose the whole building. So there's a lot of precautions that have been put in place to try to protect them. But it's certainly a worry and a concern, I think, for law enforcement and another impact of the drug on how we do business and how we search people and how we go about investigating crimes.
I'd like to thank the chiefs for those answers. A lot of you are calling in. We appreciate that. Roger, there's another call.
We're going to go to an online question, and it's from Cheryl. What is the proper way of getting rid of pills you might suspect are laced with fentanyl? I don't think it would be correct to flush them down the toilet.
That's correct. At, I believe, all of our stations, we have drug dispensing boxes that are marked. You can get them at the Highlands Ranch substation, and you can bring the drug in, and if it's in a container, we don't take liquid, but anything else, you can bring it to those locations. Also, we just had the National Drug Take Back Day this last week, and so you can monitor that. But if you have something that needs to be destroyed and you're not sure, someone passes away in your home and you go in there and inspect it, they have all kinds of prescription drugs and other kind, you can call the police departments or the sheriff's office, and we can guide you to the closest place where you live to where you can take those drugs and have them deposited safely, and then they're taken away by a company to be properly destroyed. But do not put them down your toilet or your sink, because it will contaminate the water in that region.
Well, thank you, Sheriff. Appreciate that. That's probably, gosh, how many times have we grown up knowing you got to get rid of something, just put it down the toilet, and now not a good idea at all. So just a reminder for everybody who may be joining us on the phone, please do press *3 if you have a question. And Roger, it sounds like we have somebody who pressed *3 just a moment ago and has a question for us on the phone.
Mike, you're next. Go ahead with your question.
Yes, I just wondered if there's any national program to stop the flow of fentanyl manufactured illegally in China into Mexico, where it's made into pill form, brought into the United States. We need to stop the source, which is China. Is there any national program to do that?
So, Sheriff, you grabbed the microphone, but I also have heard DA Kellner talk on this subject. So why don't you two take this one away?
I'll just be real quickly, yes. The Rocky Mountain HIDTA, which is Rocky Mountain High Intensity Drug Trafficking Area, which is a federal organization that funds law enforcement task forces that works in the region here in Colorado, Wyoming, Montana, and Utah, specifically focusing on drug interdiction and drugs being brought into those regions, and then working very closely with the DEA and other federal law enforcement agencies to apprehend the incoming of those drugs into the United States from whichever border it's coming from. So there are a number of entities. We participate in Rocky Mountain HIDTA on a regular basis with our staff, but I know the district attorney's got some other information in regard to what's going on outside of the United States.
Thank you, Sheriff. District Attorney John Kellner. So I appreciate that question. I think it's a logical one that everybody asks, wondering, well, look, we know where this stuff is primarily, the precursor chemicals are coming from, then we know where it's ultimately landing, and then from there, getting into our country, what's being done about it at the national level. Unfortunately, I would say that our DEA is largely overwhelmed when it comes to this drug. They are working incredibly hard. We work with them on a daily basis to interdict drugs in our local communities. But the bottom line is this, this drug, a couple months ago, you could probably buy a pill for $10. Now it's somewhere down to $3 on the wholesale market. And that's happening, and despite there being inflation pretty much everywhere else in our life, that's happening, the price going down because of the oversaturation in this market in the Denver metro area. And so when you ask that question, what can be done about it, I think we need more action from our state elected leaders in pressuring the federal government to take the border seriously, because this is not coming from Canada. It is primarily coming from one place and one place only across our southern border.
Well, thank you, DA. Thank you, Sheriff. Appreciate you guys keeping that bigger picture for all of us. Roger, it sounded like you have an online question for us.
This question came in from Sherilyn. She asked, could Sheriff Spurlock tell us again the names of those we should contact about the upcoming legislation?
Sure. You want to speak to Speaker Garnett and Representative Lynch and Senator Pedersen and Senator Cook. They are all on this bill, and they're the ones you'd want to contact that can help you get some more information. And thanks for asking again.
So we're always so thankful that citizens and experts come and join us in person here in our hearing room. We're certainly appreciative that you're here. I'd love to open it up to anybody out in the gallery here that might have some expertise, questions, comments for our panelists. Anybody? Hi.
Hi, I'm Priscilla, and I'm also a recovering fentanyl addict. My question to you would be, what are we doing as far as harm reduction in our communities besides the organizations that you guys have mentioned?
Thank you for the question. Who'd like to take that?
So obviously I've got a pretty narrow focus in terms of the criminal justice aspect and how we intervene with people who are struggling with addiction. I know that harm reduction is an important part of this puzzle, and I was actually struck by the idea when you said you're here and you're here to help provide resources and services on that peer-to-peer spectrum, which I think is probably one of the most effective ways that people get through recovery. But here's the problem. We don't have enough treatment providers, and everybody in the country is right now struggling with this same question, which is, well, there's a lot of people that are dealing with addiction and a lot of people who need help, and there's not enough resources pre-criminal justice system to address that. I do think that this bill going through the legislature has some important components, and one of those is a investment that's probably never been seen before in the state of Colorado when it comes to providing money for treatment providers to help get this to a place where we need it to be. I wish I could tell you that we've got everything we need right here for people pre-justice system involvement. That's just not the case. So thank you for you all doing what you're doing to help advance that cause.
And I'll just add again the Rocky Mountain HIDA, which is so important, and it's important to know that Douglas County is the fiduciary for Rocky Mountain HIDA, so we fund all of these task forces, and portion of their funding goes to harm reduction. And what we've asked again this year is to increase that percentage to focus on these 4 states, because the states of Utah and Colorado happen to be on an artery that gets the drugs brought in. And so why not affect those citizens that are living in those areas with some harm reduction programs? And so, again, there are some things that are happening right now, but as Dia Kellner says, here's the problem that we have. There is such a small amount of that sliver going to harm reduction and a lot of it going to apprehension, but we need to impress upon our legislators that we have to have the ability to hook those individuals who are bringing the drug into this state, into this country, so we have the ability to put a stop to it. When it was $10 a pill and now $3 a pill, as he said before, this is a huge problem for us, and you can't outspend this. We have to be smarter about it.
Great question, great answers. Anybody else in the room here with us that would like to ask a, yes, ma'am.
And if I could also add something to that question, too.
Sure.
Over the summer, I served on a sub-panel with the task force of legislators. There's $450 million of ARPA dollars, that's American Rescue Plan Act money, that has been dedicated by the state for behavioral health purposes. That money will be available for different nonprofits throughout the state to request that money and build programs. And the counties have asked that the commissioners be involved so that the counties are all working together. So that money is going to be coming out soon, and there'll be lots of nonprofits that will be looking to get that money in grants and help people. A lot of money coming out, and we're just figuring out how we use it to best help the people in need. So thank you for that opportunity to add that.
Yes, yes, ma'am.
My name's Maggie Calvinese. I live in Castle Pines. I know you're talking about all finances right now, but for the treatment of people with drugs, did you ever think of trying to line up with some churches where you can get volunteers to help with the drug problems here? There's a lot of big churches in this area that I know that would be more than happy to help you with your committee to help these people that have drug problems.
I can probably take that, as could my fellow commissioners. You know, we work really hard as a county to develop our faith-based partnership. So we have a robust collaboration with not only just the large churches, but churches throughout the region, primarily with issues related to basic needs. Our winter shelter network provides food and clothing, but many individuals that have those basic needs also are facing mental health issues and substance abuse issues. So great question, and I think as we continue to look at how we address opioid issues in the county, we will ask our faith-based partners to be part of that committee. Roger, we'll turn it to Commissioner Thomas.
So I think we have some questions that were submitted earlier, and one of the questions that I'd like to know what the answer is I've heard the phrases sentence enhancer and Good Samaritan mentioned in the news. What does that mean? Who would like to answer that one?
I got a lot to say about that. I'm going to talk about the sentence enhancer aspect first. So as part of this legislation that's making its way through, right now it's in the Senate, so if you have a local senator that you want to talk to, that's the person to reach out to. Part of this legislation involves what's called a sentence enhancer. A little bit of background here. I mentioned prosecuting cases involving Opana from a few years ago. So back in 2015, there was an individual who was selling Opana. There was a number of young people who overdosed and died. That's a synthetic opiate. And this person who was selling it knew that people were dying and kept on providing it, and we prosecuted this individual for murder. It's a pretty unique set of circumstances. It's not something you can easily do with the way our statutes are currently written. After that happened, after that case concluded, we knew we needed a better tool. The federal side of the House has a sentence enhancer for drug distribution resulting in death. So basically, you are a drug dealer, you sell it to somebody, they die, you are going to prison, and there's going to be a longer sentence associated with that. That's a sentence enhancer. We asked for that back in 2016. Law enforcement, district attorneys, that bill was introduced, and it died in a committee, and I think in the House back in 2016. Fast forward to now, when we have a crisis of overdose deaths associated with fentanyl, as part of the solution, or at least part of this bill, is in addition for a sentence enhancer. I think that is appropriate. I think that when people distribute a drug and people die, and they certainly know how deadly it is, they should be held accountable for that. My concern with the sentence enhancer as it is currently formulated is that it really just applies to fentanyl rather than heroin. And I struggle with the idea that 6 months from now, a parent is going to be in my office, or I will be in their living room, and they'll be asking me why the drug dealer is only charged with drug dealing but not the death of their loved one. And I won't be able to explain them a real good reason why the legislature said it's just fentanyl, other than it's in the news right now, and that's a thing that people hear a lot about. So if you do contact your senator when you leave here today, or shoot them an email, please ask them to expand that sentence enhancer to include other drugs, because fentanyl, though it is deadly and it is in front of us right now, it is not the only drug out there. And once, if we are effective in cracking down on fentanyl, these cartels will pivot to a different synthetic opiate and will simply produce another drug that is just as deadly. Because fentanyl is not new. It's been around since the 1950s. It's just become popular for production right now from cartels. So I've urged the legislature to get ahead of the next crisis by expanding this bill. Did you want to talk about the Good Samaritan portion, Sheriff?
I'll just say that the Colorado Chiefs of Police and County Sheriffs of Colorado have urged the senators I spoke about is to eliminate the Good Samaritan option of this law, because there is no way that we should be giving folks who have knowledge that they are possessing and selling that. So we believe that that should not be extended to dealers and people who are providing this drug to individuals. This is just another escape route for individuals that are harming other people. So the collective law enforcement has opposed that in the bill. And again, I'd encourage you to reach out to their representative senators and ask them to remove it from the bill.
No, thank you, Sheriff. Thank you, DA. Roger, it sounds like we have a question on the phone.
We do. Let's hear from Nancy. Go ahead. You're live.
Hello, good evening, and thank you so much for all this information. Something that perked my ears up was your mention of fentanyl being dusted over marijuana. And I was curious as to, is this happening in our dispensaries, or is it more a street thing that you're seeing?
I can answer that to some extent. I have heard of fentanyl being in some fashion mixed with marijuana. I've not seen a case of that yet. And that's a good thing. I think it's in pretty much everything else, but I've not seen that yet in my office. Something to keep an eye out for, certainly. Certainly something that we need to talk to our kids about. For anybody who's listening, who's got a kid in high school or a young adult, talk to them about the dangers of fentanyl, about what you've heard today. That was really the goal behind this whole thing, was to just raise awareness, because this is a crisis. It is an epidemic. It's not going to be solved with jails, except for the dealers perhaps, but I'll tell you what, it's going to be solved with education and prevention, and that starts with everybody who's listening and everybody in this room.
Well, thank you again, DA Kellner. Folks, looking at Mickey's big hand, it does look like our time together tonight is coming to an end. Roger, can you go ahead and help us out with the wrap-up, please?
You bet. Thank you very much. Be sure to join us for future town halls. Just visit douglas.co.us/town hall to sign up and ensure you are called for our next town hall. Before we conclude tonight, let's go back to your commissioners for some final comments. Commissioner Layton, let's hear from you first.
Roger, thank you, and a tremendous note of gratitude to all of our community partners from the school district, Sky Ridge, all of our law enforcement agencies, the DA. I see one of our wonderful victims advocates here, and all the experts in the room. As we move forward from conversation to action and look at this $4.9 million in the opioid settlement for Douglas County, there are so many opportunities for us to explore potential impact, and I just wanted to touch on a few of them because they were raised in the room. So they fall under the primary categories of treatment and prevention. And I think, one of the areas where we can expend funds if the board chooses to do so is to expand the availability of treatment, including medication-assisted treatment for opioid use disorder and any co-occurring substances use or mental health issues, training for healthcare providers, students, and other supporting professionals such as peer recovery coaches, and including but not limited to training for MAT and other harm reduction. And then just from an intervention standpoint, ensuring that healthcare providers are screening for that opioid use disorder, OUD, and other risk factors, and then knowing how to appropriately counsel and treat a patient for OUD treatment. So we'll begin that process in a robust way, hopefully in partnership and conversation with all of you. And again, I just want to thank you for sharing in the dialogue with us tonight. Commissioner Teal?
Commissioner Thomas, would you like to go ahead?
Thank you, George. I'd like to thank the people who called in and shared their personal stories of loss, the women here who talked about their recovery and offering to help others. This is all about partnerships going forward to help others. When I was a state trooper here in Douglas County, I was what was called a drug recognition expert, and I went through weeks of training to recognize the signs of people who were under the influence of the seven categories of drugs or combinations of those 7 categories of drugs. And I learned so much about the physiology of what those drugs do to people that it scared me. And I wish everyone could understand that before they start experimenting with these drugs. But I understand it's a bigger picture than that. And that's why we're here tonight. We've got all our partners here. We've got the schools. We know that the legislature has got lots of money that we can use through nonprofits to help others. We've heard comments about churches. And Douglas County has got great partnerships with our churches. So I think there's lots of potential of what we need to do, and we're at a point now where we can start identifying how to use ARPA funds and build programs to help individuals. I served as a Douglas County coroner, and I've seen what illicit drugs can do to others. So God bless all of you. Thank you for being engaged. Commissioner Teal.
Thank you so much, Commissioner Thomas. Well, thank you, everyone, for coming and joining us this evening for this very important topic. Hey, Chiefs, thank you so much for being here. I spent 6.5 years working with Jack Cawley in Castle Rock, and I can tell you, I know that he shares the burden, and he shares and works through solving the problems that you do as well. Sheriff, thank you so much for bringing this to us. Hey, John, DA Kellner, when you called and you said you wanted to get this on, I think you had very strong support from your commissioners to bring this forward, have this conversation. I know you're a Marine, so semper fidelis, or as we used to say in the American Army, because we speak English, always faithful. It's just a little inter-service humor there. But thank you all. Thank you for the folks who came and joined us this evening and brought us your questions. Especially, ma'am, thanks for that question about our faith-based partners and what we can be doing. That lit a light bulb for me. And of course, thank you everyone who joined online. Thank you for everybody who called in. And it's because of your participation that these town halls really represent what's going on in Douglas County. Roger, can you wrap it up for us?
Absolutely. On behalf of Douglas County, thank you for joining us this evening. If we did not get to your question tonight, we invite you to submit any question you may have about this or any other topic to douglas.co.us/citizenconnect. We hope you'll join us again for future town halls, and it's only 2 days away. Thursday night is our next town hall. So please join us, and again, thank you and have a good night.